Panchakarma is actually cleaning the body to take out the toxins out of the body. So it's a long procedure. There is pre-purification therapy, purification therapy, and post-purification therapy. Panchakarma is purification therapy. So first I will start with the pre-purification therapy, in which internal and external oleations are there. So first we give Snehana, that means ghee, administration of ghee to make internal oleation, and also external application of oil for oleation of the body. Why? Because all these Panchakarma treatments, that means intended vomiting, nasal infusion, purgation, oil enema, and decoction enema, all these things are rukshana, that means it causes dryness in the body. So you have to first make oleation or snehana to make it oily, so that the purification treatment would be done in a better way. In the body, the toxins or wastes are collected in three forms. That means one in gaseous form, where breathing exercises, pranayama, yoga can help you to bring it out. The second form is water, liquid form. The kidneys can take it out. That means by using diuretic, by giving diuretics, you can take the waste materials in the liquid form. But in the third thing is it is collected in the fatty form. That means the toxins collected in the form of fatty form, which is very difficult to be removed from the body. So when you administer the ghee, this will stick on to this fatty form of toxins or ama. The toxins which we call it as ama, it sticks on to that and gets when you apply heat over the body, it becomes liquefied and it goes into different channels. That means it goes into the sinuses, it goes into the lungs, so large intestine, stomach, small intestine, large intestine. So from these areas, it has to be taken out. So for that purpose, this 5 types of Panchakarma or 5 types of procedures has to be done. When it is collected in the sinuses, you do nasal infusion to take it away. When it is collected in the lungs and stomach, you do intended vomiting. In small intestine, when these toxins are collected, you take a purgation. And when it is collected in the large intestine, you do enemas. That means oil and Niruha Basti as well as some Snehana Basti can be done to remove these toxins. So that is what Panchakarma is.
Wow.
So after this procedure, we have the post-purification therapy, where the body needs to be rejuvenated with treatments and food. Special food is also advised during this period of time. Doing all these procedures, I would rather tell that it is best to have 3 weeks, because this has to be done in not everything together. So there is a period of time where the ghee has to be administered. So 3 days, 5 days, or 7 days, according to the disease. We always tell for minimum 14 days, but it may, according to the disease, the patient may need more time. It all depends on diseases and what they do have. And some people, they may need to do it at least once in 6 months even. But according to if they do have a chronic disease, they need to, for example, ankylosing spondylitis or arthritis, which is a very serious arthritis. Sometimes they need to come once in 6 months. But usually I would recommend once in a year. Actually, Panchakarma is to clean the toxins from the body, by which the patient may have more action of the medicines in the body. So according to Ayurveda, when these toxins are collected, so it gives an environment for the viruses or whatever things to live inside the body. So when you take out these toxins, there won't be an environment for these things to live inside the body. That is one thing. So in the case of cancer, more than herbal preparations, sometimes we may need rasa preparations where the serious illnesses could be treated only with that. There are special treatments in Ayurveda called Rasayana treatments. So this Rasayana actually improves health and destroys the diseases. In Maliga, you can get a genuine treatment. We do all the Panchakarma treatments. And also, we have special treatments for women. Those people who come for endometriosis. Endometriosis can be managed only; it cannot be treated completely. But PCOD, PCOS, those type of things can be treated. We do have very good treatment for stress. A lot of people do come over here for the introduction, and we have very good results for that also. A person can do Panchakarma till 70 years of age. After that, all the Panchakarma treatments cannot be done on their body. They could have massages and other treatments, but Purgation and all other serious treatments cannot be done. It's also based on 𝐁𝐻𝐈𝐒. If the person at the age of 70, if he is very energetic and if he could take according to if the doctor feels okay, he can give it. But usually we won't recommend this Vamana and Niruha Basti in patients who would be above 70 years of age. A light purgation can be given, but seeing the 𝐁𝐻𝐈𝐒 or the physics of the patient.